My name is Selchen. I'm the Chief of Psychiatry and Medical Director of our Mental Health and Addictions program here at Humber, and I started on March 1st, so I've only been here for a couple of months. So I've had a really fortunate education. I got to study medicine and psychiatry here at the University of Toronto. I got to study Eastern and Western psychology at the University of Oxford and executive leadership at Harvard University. So I've had a great experience from that perspective and a great experience professionally in terms of work as a psychiatrist, a clinician, an educator, a researcher, and an administrator. I've gotten to work in some of the largest academic centers in the country, but I've also got to work in some of the community hospitals and community agencies all across our province. So it's been a great experience. I'm really excited to be here at Humber and to continue that work. I tend to focus particularly on things like anxiety that's really tough to treat, and depression that's challenging to treat, and working with people also with stress and burnout. And so, again, really excited to be here at Humber. I'm really looking forward to being here and working we have an extraordinary team here. We have a dedicated team of doctors and clinicians and administrators and other staff, really eager and working hard to serve our community and to work with our community, to work in partnership across the organization, but with all of our community partners. So really excited about these opportunities, and this is my home community. I've lived here for decades. My kids have grown up here. They go to school here. So really excited to be able to make that kind of contribution to our home community. You know, what has to happen, we're at a very interesting time from a mental health and addictions perspective. Probably the need has never been higher, but also, you know, the stigma in some ways has never been lower. I think since the pandemic, people have really been talking a lot about their mental health, and we're seeing a lot more willingness to seek help and to work on our mental health. So we're at an extremely important time. The road ahead is complicated. We're going to need innovation, we're going to need technology, we're going to need data and digital health in order to be able to serve the population the way that we need to. And Humber River understands that. This is a place that is providing leadership in digital health and leadership in innovation and in making the kinds of changes that we're going to need to in order to be able to address our mental health and addictions needs going forward. So we're really excited to be part of that work here. So there's lots of ways that we can help ourselves in terms of our mental health, and especially if we're struggling with stress or burnout or anxiety or depression or things like that. So first of all, we have to start with recognizing what's going on and acknowledging if we're finding that it's challenging, right? Lots of us are just trying to get through the day one way or another, but we have to do more than that. We owe it to ourselves to recognize what's going on. It's really important that we aren't just trying to get through the day, and I know that's easier to say than to do. Lots of us have lots of duties and responsibilities in order to make ends meet. I know it's harder and harder these days, you know, just to be able to afford basic things. So there's lots of things that take us, you know, that catch us up in our days. But at the same time, we also need to make time to care for ourselves. And so, you know, as we look at our days, are we doing things not only, you know, our duties and our responsibilities and, you know, our work and things like that, but are we also doing things that feel nourishing, things that feel enjoyable, things that feel like an accomplishment, and things that feel meaningful to us. Right, we are meaning-seeking beings, and a lot of us can feel like there isn't, you know, much meaning in our day, that we're just kind of getting through things. So it's very important for us to look at where are opportunities to engage with other people, to feel like we're making a contribution to, you know, to each other and to the world around us. And it can be little things like how we give of our time or our energy to each other. And then most importantly, though, often this is too hard for us to do on our own, right? So a willingness to seek out help, to talk to your family doctor if you have one. If you don't have one, to get on a list for a family doctor, to reach out to us, our hospital, our health system, our partners. We're really eager to be able to help people that are struggling in that way. And so a willingness to ask for help and to seek that out so that we can work with you is extremely important for taking care of our mental health.